There's this question that has been living in Kenyans' mind for the longest time possible, but unfortunately, we've not gotten a definitive answer to. The question is, does SHA actually work?
If SHA is really working, then why do we have so many medical fundraisings kila wakati?
On paper, it works perfectly. In press conferences, it works perfectly.
Hizo mahospitali zote, ukienda pale, unatibiwa na unaenda nyumbani bila ya kuulizwa pesa yoyote. Na mtu akikuuliza pesa, itisha polisi.
But in hospital corridors, in maternity wards, in emergency rooms at 2 a.m., that's where the truth actually lies.
This man has a child. Come sit here. He has come all the way from Kibwezi. Come and sit here. His child has swollen a coin. From yesterday, he has been waiting for the SHA to work. It is not working.
But I'm so glad that Kenyan TikTok moms have come out with hard facts and exposed the disgusting mess in SHA.
How much does it actually cost to give birth at MPESA?
Let's talk about how much it costs to deliver at AIC Kijabe. These are prices for the main hospitals.
How much it cost me to deliver at Nairobi West Hospital.
So here is how much my unmedicated vaginal delivery costs in Outspan Hospital.
If you love this kind of content, go ahead and like this video and subscribe. Now let's get to the video.
A report done by the Rural and Urban Private Hospitals Association of Kenya, it has revealed that 9 out of 10 Kenyans are still paying for medical services out of their pocket. And SHA is not able to cover that.
The system we are talking about is Social Health Authority, SHA. The government says that it works.
You can go to any hospital in our country, public, private, and faith-based.
And they must take you in.
They take you in, they treat you, and they bill SHA, and you walk out.
That's BS.
The opposition says that it doesn't.
If SHA is working, why are county staff refusing it as part of their health insurance and they are opting for private insurance? We've seen this with Nairobi county staff and Bungoma staff. Wanasema hapana, si hatutaki SHA, mtuchukulie private health insurance.
But what about ordinary Kenyans? Do they know whether it works or not? The truth is, nobody knows. Until the day they walk into a hospital and they are asked, do you have SHA? Personally, I have stood in a private hospital reception with a critically ill patient. They asked me, do you have SHA? I said yes. They asked, what kind of SHA do you have? And that is where I began to be very confused because I thought that I had registered for SHA. When I was registering, I wasn't asked what kind of SHA I want. I just knew that I had SHA. But the hospital asked me, how do you pay for your SHA? And I said, I just pay like through MPESA. And they told me, that one we do not take because it's not a civil servant's SHA. I didn't know that there were two kinds of SHA. But suddenly, SHA could not admit my patient. I had to pay out of pocket 50,000 Kenya shillings for the patient to be admitted. So, what exactly did I register for?
And you know, my brother Mosiria, you got a referendum here on SHA. Please go and tell those wonderful people to do the right thing. These are the people who get the services and they are talking back to you and telling you the services don't exist.
Here is the reality that many are discovering. SHA works on small bills, small procedures, small outpatient visits. Those ones are fine. But the moment you have a big bill, you are actually on your own.
And the total bill was 215,270.
And nowhere is this more painful than in maternity. Women on TikTok have started sharing their delivery bills. 200,000 Kenya shillings, 300,000 Kenya shillings, 400,000 Kenya shillings.
Altogether, our combined bill came to 439,191.
Total service amount 251,787.99 cents.
That gives you a total of 200,000.
So the total amount for me was 114,690, and also I had charges for private doctor was 50,000, and for their in-house pediatrician was 25,000. So my whole bill plus the doctors was 189,690. Adding the baby's charges, that came to 213.
And how much is SHA actually covering?
Then out of the 200,000, SHA paid 30,000. So we paid a total of 170,000.
Insurance yangu ilinikaveria kama 77,000 and then I had to top up like 140 Gs. SHA ilinilipia 30,000 shillings.
114,690 post SHA, which was deducted 10,000. And
10,000, that is for normal delivery, and between 20 and 30,000 when it comes to the C-section. Out of 400,000 Kenya shillings, 30,000, you do the math. How is this universal health care?
Umejiandikisha kwa SHA?
Nimejiandikisha.
Hiyo
ni requirement moja.
Very good. Very good. Sasa hapo tunataka kipange kila mtu hapo ndani, ndio mambo ikienda namna hii ukiwa mgonjwa unashughulikiwa.
Now, to be fair, if you go to a government hospital, SHA can actually cover most of the bill, but at what cost? Overcrowded wards, mothers sharing beds, 2 to 3 women on one bed, premature babies actually sharing incubators, slow services, medicine shortages, healthcare workers doing their best, but of course they are overwhelmed. So the message is clear. If you want dignity, comfort, and faster service, you pay out of pocket. If you can't, endure the conditions. Is this the choice that we are giving our Kenyan mothers?
Now today we are talking about the SHA rollout chaos. You already know SHA officially went live on October 1st, 2024, and the NHIF admissions, they stopped on September 30th, 2024.
Now, for those who don't know, SHA replaced NHIF. We were told that it would be better, more efficient, more transparent.
This digital transformation is giving Kenyans faster, more transparent, and more dignified access to health.
But I know people who gave birth using NHIF and actually walked out of hospitals, which were actually private hospitals, without paying even a bob. Now contrast that with what is happening today. Even with SHA reductions on your bill, you are still paying 80% to 90% out of pocket. And if you bring your own specialist, that is extra money.
And also I had charges for private doctor was 50,000, and for their in-house pediatrician was 25,000. So
completely out of pocket. So again, what changed?
At the time I said, the problem is not you going to the hospital to be seen. The problem is SHA paying the hospitals. And it's now apparent private hospitals that were taking SHA are now turning patients away. There's a place I usually go to spend some time, and we've been seeing SHA patients. Tumekuwa hata na kazi mob sana, unashangaa wagonjwa waishi because they were accepting SHA, but suddenly cut off. Because of why? Because SHA is now paying back the hospitals. SHA owes the hospitals billions and billions in claims they don't pay. And that is the problem.
So this is no longer just about policy. It's about trust. Because the government insists that the system works, but the people using it are telling a different story. And when mothers start speaking, when parents start posting hospital bills online, when young families say that they are afraid of having children because of the medical costs.
Giving birth is a luxury that for now I cannot afford.
That is not opposition propaganda. That is lived experience.
15 December. Hello. Don't cry, it's okay.
Pesa ngapi? 110,000.
You see, Kenya is not a poor country. We are a country with resources, with budgets, with priorities. So why are our mothers sharing beds? Why are families fundraising after delivery? Why are Kenyans discovering coverage limits when they are in deep crisis? Healthcare is not a luxury. It is actually a right.
Healthcare is not a favor, and it is not charity. It is a constitutional right. And when the system repeatedly fails the poor, when suffering is only addressed after public shaming, when justice depends on media exposure, we must confront a painful reality. This system is not broken. It is indifferent. It is indifferent to pain without power. It's indifferent to suffering without money. And it is indifferent to lives lived far from privilege.
This is a direct challenge to William Ruto and Aden Duale. If SHA is working, show us how. Because right now, TikTok moms are telling a different story, and you cannot gaslight thousands of hospital bills. So, I want to ask you a question. Have you used SHA? Did it work for you, or did it fail you?
So in total, my total was 44,759 Kenya shillings. SHA covered 10,200 Kenya shillings. So out of pocket, we paid 34,559. So this is Outspan Hospital.
Have you been told one story while living a different one? Drop your experiences in the comments below, because healthcare should not be a gamble, and giving birth in Kenya should not feel like a financial punishment.
Birthing is an expensive exercise, bro.
Now we have a till number to the channel. You can directly support this channel through your contributions. No amount is too little, no amount is too big. I want to big up everyone who's been supporting the channel, and God bless you abundantly.
My brother here says SHA is a state-of-the-art system. A state-of-the-art system that does not work. It doesn't work. For you to be able to flag out fraud, listen to me, please, listen. For you to be able to flag out a fraud, that system cannot.
It can't.
You have to call.
It can't.
It has to be manual.
Yeah.
Subscribe.